Welcome everybody to our September Learning Cafe. Seems crazy, it's already September, but it finally feels like September, so that's a big plus. I just want to give a reminder to everybody. We will drop a copy of the slides into the chat momentarily, and then we'll do that again at the end for anybody who wants a printable copy of the slides. I just want to encourage people to, take breaks as you need to. We're all adults. We're not going to take a break during this presentation. It's only about an hour long, but take breaks as you need to. We will be, at the end, we're going to put a link to the survey in the chat. I want to remind you all to please complete that survey. I'll put my plug in for completing that survey again later. But that we use your feedback to help inform how we're doing these. And if you have suggestions about what topics we should cover, we very much value that. It helps us look for presenters. And better yet, if you know of somebody who's a really good presenter on a topic, please suggest that. Always looking for people to bring in to do these presentations for us. But also in order to get a certificate for attendance today, you need to do that survey. So once that you've completed that survey, it'll take you to kind of your certificate of completion for today that you can use for CEUs or whatever you might need that for. So, all right. I also want to remind everybody we're recording this today. You probably got a pop-up on your screen that told you it was being recorded, and we will, in a week or so, try to post this video to our YouTube channel. So if you have any colleagues who might be interested in watching this, you can share that link with them. We'll send it out when we send out the reminder for next month. But they can watch this presentation via the YouTube channel as well. Well, I am really happy to have Dr. Caitlin Williams presenting for us today. She is our postdoctoral fellow here at the Center of Excellence for Children in State Custody. Sadly, this is her last couple of weeks with us, but we've managed to squeeze 2 trainings out of her, and the last one was really good, so I'm really looking forward to this second one. Dr. Williams comes to us. She got her doctorate degree in clinical psychology from George Mason University, and then completed her pre-doctoral internship in the child and family therapy track at the University of Arkansas Center for Medical Sciences. And then she completed an initial postdoctoral fellowship with Cherokee Health Systems before coming to us. And so we are really excited to have her present to everybody today on trauma-informed foster care for LGBTQ plus youth. So, Dr. Williams, I'll turn it over to you and let you take it away.
Nice to see some faces today. I'm looking forward to talking with you all. So, like Dr. Corbin was saying, we're going to talk today about trauma-informed foster care for LGBTQ plus youth. My pronouns are she and her, which I noted on that first slide. I see some other people noting their pronouns on their Zoom account. Feel free to note that if you'd like, but if you're like, what are you talking about, Caitlin? We will get there. So I want to start off by talking about some objectives. So first, we're going to review and define some relevant terms for our discussion. We're going to also address some common misconceptions about the LGBTQ community. In addition, we will discuss some current research on particularly LGBTQ youth in foster care. We will also be talking about how to support LGBTQ youth who are in foster care and going through some practical tips and ways that we can enhance their support and help them feel validated and accepted. And we will also go through, there's a brief kind of resource slide at the end if anybody is interested and wants to learn more about anything that we've talked about today. There's some resources that'll just be a good place to start. All right. There we go. So before we start talking about LGBTQ youth and learning more about foster care and their experiences, I first want to start off by acknowledging that for our country right now as a whole, our society is really in a sort of a polarized place around LGBTQ youth and LGBTQ healthcare. You may be hearing articles about LGBTQ and transgender athletes. We may be hearing more about bathroom bills, as they're called, in various states throughout the country. My home state of North Carolina became famous a couple of years ago in a bad way for one of the bathroom bills that they were trying to pass. There's also a lot a lot of things emerging sort of out of Texas and Florida, various bills that are in the legislatures there being debated about what can be taught in different school settings. And in Texas in particular is a very relevant issue for us who are involved with DCS, because pursuing gender affirming care has now become something that they're labeling as potential child abuse and making that eligible for DCS investigation. So I bring all of this up to the start, at the start, just to really acknowledge that our country can be divided and often is quite divided on issues related to our LGBTQ population. And I want to acknowledge that people may hold personal beliefs that don't quite jive or don't quite mesh with some of the things that we're going to cover today. And I want to acknowledge and validate that that's okay, that this is a safe space for that and for disagreement. However, also acknowledging that within our work and our professional sphere, there may be things that kind of conflict with our certain personal values, but that still are called for us to do or to engage in that work setting. So a great example may be, if you don't have personal beliefs that align with LGBTQ community, but you have a kiddo on your caseload who identifies as trans, that might be a little bit of a tension between, wait, this is what I personally believe, and this is what my job is calling me to do. And so I have this common ground animation on here because that's really my goal for today, is to think about how can we take or how can we find some common ground in an area where our personal and professional beliefs here may not align. And that's okay. That doesn't mean we just throw in the towel and give up on trying in the first place. So I really want us to feel, or I want you all to feel after this training like, okay, I took away some things that can be useful for me, or I learned some things that I didn't know before, or I thought about things in a new way. And also remembering that even if something in my personal belief system doesn't align with the things that we're talking about today, the kiddos on our caseload and the kids we work with in therapy rooms and those who we interact with who identify as LGBTQ are still looking to us in our professional sphere and our professional role for support and for acceptance. So my hope is that things we talk about and things that we go through, and whether it's new material or revisiting old material for you all, that you're getting some takeaways that can be helpful, at least on that professional sphere, that kind of professional ground. And with that said, I just want to lead off with this idea that we're all human. So these are the different flag colors for various communities within that LGBTQ umbrella. So that's what I'm representing there with that human. Why those are all different colors like that, but just that reminder that where can we find that common ground with the kiddo on our caseload, even if I don't believe in all the things that we're talking about today personally, I need to remember that this person in front of me is a human being. And where can I go from there? Once I acknowledge their humanity, how can I continue to support them in various ways through my sort of professional sphere? So with that said, just a little bit of humor to get us going here. This is an alphabet soup situation, potentially. LGBTQIA, QQIIAA++. There's a lot of letters there to keep up with. And I want to start off by just kind of going through a couple of definitions to make sure that we're all kind of operating from the same page. So LGBTQ people have always existed, even if the language that we use to discuss this population may seem new and may also seem to be changing a lot, because the pace of change more recently in our country, I think, has picked up in terms of the conversations we have and the letters we're using and the people who are included in this community. That seems to maybe grow every day or change overnight. And so I want to acknowledge that too, that even if the language is changing, and it will probably continue to change, these are just sort of the basic letters of the alphabet that we're going to start off with for the LGBTQ umbrella, but understanding that this list is not comprehensive and it may not include the identity that somebody tells you about who you're working with. And that's okay if it doesn't seem to fit in with the terms that we talk about today, because whenever we're talking about identity terms, I really just want you to keep in mind, trust the person who you're talking to. Trust the person who's using that term and their definition of the term for them above any dictionary term or definition or something that you've heard before. So keeping that in mind, that it's okay to not know all the terms because things change all the time. It's also best practice to sort of go with what the person in front of you is giving you and use their definition and their identity terms in order to make them feel comfortable, included, and to really be hitting home that inclusive environment. So just going through first LGBTQ. So L in this stands for lesbian. So a woman who is emotionally, romantically, or sexually attracted to other women. G stands for gay, which can have two different meanings. So sometimes it's used to describe men who are attracted to the same sex, so attracted to other men. However, gay can also be sort of an umbrella term to describe anybody who's attracted to the same or similar genders. So sometimes you might hear gay in a couple of different contexts, and just know that these are sort of two of the most commonly accepted meanings for that word. The B stands for bisexual. So people who are attracted to more than one gender. And typically bisexual refers to people who are attracted to both males and females. So on both sides of, hence the bi, so bi meaning two, part of that word. So meaning that people are attracted to males and females. The T stands for transgender. So those whose gender identity or expression differs from cultural expectations. We'll talk about gender identity in just a second as well. But being transgender does not imply any specific sexual orientation. So the first three terms, the L, G, and the B, those refer to someone's sexual or romantic orientation, meaning who they're attracted to. Transgender, however, refers to how someone identifies. So it has nothing to do with who someone prefers romantically or sexually. Q is another word or another piece that has two potential meanings here. So sometimes Q means queer, which functions in this case not as a slur, which is how oftentimes it was used historically for folks in this community, but queer has kind of been reappropriated and is now sometimes used as a catch-all. So it's a term that can include those who do not identify as exclusively straight, or folks who see themselves as being what's called gender fluid, meaning they don't have a specific gender identity that is consistent. Outside, like they're not identifying as transgender or cisgender per se. So queer can be another one of those kind of umbrella or catch-all terms. However, it can also stand for representing those who are questioning their identity or in a phase where they're still trying to figure it out. So Q on this one can mean queer or questioning. Oftentimes it's used to represent both definitions. Oh, my slides are freezing just for a sec. Here we go. Okay. So finishing out with just some of these letters here, you sometimes will see LGBTQIA+. So just to finish out with those two, the I and the A, I refers to intersex. Intersex is those who are born with differences in their sex traits and their reproductive anatomy that don't classify them as male or female. Asexual refers to folks who lack a sexual attraction or sexual interest in others. So asexual is going back to like with lesbian, gay, bisexual orientation, romantic or sexual orientation, who we're attracted to. Whereas intersex, similar to transgender, is more about identity or biological sex, which we're about to come back to on our next slide. It's just a little bit of a preview. And the plus symbol here leaves room for other sexual identities or orientations that are not covered in the acronym. So oftentimes I'll hear people be like, well, how am I supposed to keep up? There's so many words and acronyms to choose from. And that's where that plus comes into play. The plus is sort of like, there's other things here. There are plenty of other terms that folks might use to describe their identity or their orientations that may just not be covered. So that's what that plus symbol is referring to. Throughout this presentation, I will just be using LGBTQ+, and in part for just sort of word space on the slide, so we don't have too many words or letters all on one slide, and also just because that's one of the more common sort of umbrella terms that you'll see is LGBTQ+. So a brief kind of terminology primer here to help us orient further into the discussion that we're having about various terms and identities and how identity differs from attraction and things like that. So sex, or what is sometimes called sex assigned at birth or biological sex, this refers to a label that you're assigned by a doctor when you're born. Usually a doctor will just look at your genitals and make a determination about your biological sex based on that. However, your chromosomes and your hormones also go into making that determination at times. So your sex is what's listed on your birth certificate, and usually male or female. Intersex is a popular, folks who are intersex are gaining more and more visibility within the LGBTQ movement and having more of an advocacy push recently, because historically, kids who are born with multiple sets of genitalia or who have mixed chromosomes or hormones that are indicating male and female sexes, often these kids will be sort of assigned to one gender or another without someone's knowledge or without that kid's choice, because oftentimes these choices are made right around birth or in the first couple months of a child's life. And so there are reassignment surgeries that intersex children can sometimes be subjected to. And a lot of times when these surgeries or medical decisions are happening when kids are so young, they're being made in conjunction with the doctor and the caregivers or the parents. And so more and more recently, folks who are intersex are starting to come forward and advocate for themselves around, we don't have to be put into the male or female bucket. We have a bucket sort of all for our own. So those are the three most common terms that we'll see when we're talking about sex, or again, what you might hear referred to as biological sex or sex assigned at birth. Gender. So gender is a social and legal status. It also is a set of expectations that we receive from society about how we should behave, how we should dress, what characteristics or mannerisms we should display, and different thoughts about who we are and how we fit into that gender binary, or usually the male and female genders. So each culture will have standards about the way that people should behave based on their gender, usually along the male and female binary. So in America, we say that pink is the color for girls, blue is the color for boys. And so you'll notice if you're in like a preschool setting or even elementary school setting, sometimes things will be divided along that gender binary. And there'll be pink toys and princess toys and playing house stuff and food toys, maybe for the girls. And for the boys, there might be superhero toys or G.I. Joes or bats and balls or other toys that we would maybe put into that more masculine bucket. So these are examples of gender and of those expectations that we're receiving from society about how we should behave based on our gender, based on what we're presenting sort of outwardly. Your gender identity, however, is how you feel on the inside about yourself. So how you express your gender through your clothing, your behavior, and your personal appearance. It's a feeling that usually begins pretty early in life. So oftentimes our gender identity is something we start to feel and something that can stabilize around age 3 to 4. However, for a lot of folks as well, gender identity is not something that is set around age 3 to 4. It is something that continues to shift and change as people grow up and get older and interact more with others around them and others in society. And so that's a really important point here, is that gender identity does start to set, and like people start to think more about who we are and how we fit in with gender around age 3 and 4. However, someone's gender identity process and figuring out what their gender identity is can subsist well into adulthood, especially if people sort of come later to the game of figuring out who they are and who they're attracted to and what they're interested in. What we see, I think, a lot these days, at least what I see clinically, is people who are coming out or sharing more about their orientation or their gender identity earlier and younger. I'll have kids who are saying around 10 or 11 now that they feel they're transgender, whereas even just a couple of years ago, it would be sort of my older teens, my early college students, and even sometimes adults who I would start to work with who were just now determining that their gender identity was something different than they thought it was before. So someone's gender identity, like all of these things, gender identity, romantic orientation wise, can shift over someone's lifetime. So to get into a little bit more of the nitty-gritty terminology here, we're going to start off with the gender binary. So when I talk about the gender binary, bi, again, meaning two, and binary here being like there's one side and there's the other side. So when we're splitting gender into a binary, we're thinking about two distinct and usually opposite sexes. So this is where we have male, female, or masculine, feminine, or woman and man. Those are examples of the gender and sex sort of binary, of people saying like there's one side and there's the other. However, we use that terminology as well to think about, to deepen our understanding of what folks mean when they're saying I'm transgender. So this is an umbrella term used to identify people who their gender identity or how they feel about their gender on the inside is not the same as the sex they were assigned at birth. So trans or transgender, both of those are acceptable, sort of interchangeable terms. That's referring to when I feel like, oh, I was given this sex at birth, but that's not how I feel on the inside. There's a mismatch here. That's an umbrella term to capture those folks. Cisgender, on the other hand, is the opposite of transgender. So when someone is cisgender, that means that how they identify their gender identity is matching with their sex assigned at birth. So for example, I identify as cisgender. What that means is that a doctor looked at me when I was born, being 2 weeks late, sorry about that, mom, and they determined that I was biologically female. And as I started to grow up and understand more about myself and the world, I very much identify as a female. So my gender identity and my sex assigned to me by a doctor at birth, they match. So that is the term we use. Cisgender is the term we use to refer to people whose sex assigned at birth and their gender identity or how they feel on the inside matches. Genderqueer. So genderqueer is a term that captures people who feel like they don't identify with that binary. What that means is that they may feel like they're not really male or female at all. The idea of somebody having to fit into a male or female gender does not fit or does not work with people who identify as genderqueer because they see themselves as being outside of that binary. It's kind of like, well, I don't feel like I'm male or female, or I'm some other gender that's not captured by what we see on the binary. If there's only male or only female. Some folks see gender, and we have a much better understanding of this now than we did even just a couple of years ago, but gender is a spectrum. And so there's not only point A and point B, there might be other points along that as well. And so someone who says that they're genderqueer, or you might hear the term non-binary as well, that's what that means, is when someone does not identify with the concept of gender being binary. So they may identify somewhere, some other gender altogether, or feel like my gender is fluid. So gender fluid would be another terminology here, another word to kind of capture that idea of my gender is not working with this concept of a binary. Transitioning. This might be something that you also are seeing a lot in media, news articles, maybe in your personal life, on your caseload. The concept of transitioning is when we are changing our gender expression to match our gender identity. So transitioning can include lots of different things. It can include changing how we dress. It can include changing the hormones in our bodies. It can include gender reassignment surgery. So there is a wide array of behaviors that fall into the idea of transitioning. A lot of times when we hear transitioning, we think we go straight away to the idea of a medical transition or someone who's getting a surgery to change their body to fit into a different gender category. That is absolutely an example of transitioning. And I also just want to point out that there are other ways to transition or many other things you can do along that path before getting to the surgery point or in addition to surgery. So transitioning applies to more than just surgery or more than just the idea of medical changes. Okay, this is a little handy dandy graphic, I think, to kind of indicate cisgender and transgender using the binary here. So you'll see there's only woman and man represented. So going to the right on the cisgender side and seeing cisgender woman, that's what I was just describing. So I'm a cisgender woman, which means my gender identity matches my sex assigned at birth. However, when we oh, no, okay, my table started a different spot. So similarly, if a man who feels and expresses themselves to be a man and a masculine, and they were also assigned male sex at birth, their gender identity then is a cisgender man or a cis man. A lot of times people drop the cis for the cisgender and just say, I'm a man. And that's certainly fine. That's certainly okay. Sometimes we add the cisgender just to indicate that like this isn't necessarily the norm, even though the vast majority of people do identify as cisgender instead of transgender. We can use the term cisgender when describing ourselves if we want to indicate that like I'm trying to be more open and inclusive and not just assume that everyone in my sphere right now is cis. So sometimes you can say like, I identify as a cis woman, in part to sort of open the communication so that other people can feel comfortable to identify themselves however they feel, whether trans, cis, or something else. We already talked about this piece here. This is the me example, female, woman, cisgender woman. However, if at birth you were assigned the sex of female, but you feel like your gender is male, then you qualify, your gender identity is transgender man. What that means is that you are expressing your gender identity as that of a male, but you were assigned at birth female sex characteristics, or you were given that designation of female at birth based on your usually outward sexual characteristics. And then the opposite of that, so if you're born male, but you identify as a woman or feel like your gender is a woman, then you're a transgender woman. So if someone is trans, we use the, so to figure out like, okay, I'm transgender, but wait, are they trans man or trans woman? We use which way they feel like their gender expresses. So I'm using transgender woman when I'm referring to this last category here, born male, but is woman. That's a transgender woman because that's representing the category that they feel like, the category of gender they feel like best represents them. Okay, I want to transition next and talk about pronouns because we've talked a lot about identity and differences between orientations, whether sexual or romantic, and gender identity or how we present with our gender characteristics. And then pronouns often come up as the next step. And this has also gotten a lot of attention recently with some people being like, what? I don't even know really what pronouns are grammatically. Like, since when did this become a thing? Where like when I started my presentation, I'm like, oh, my pronouns are she, her, because I guarantee you for a long, long time, that was not the norm. And I would still say it's not the norm, but the reason we're moving toward that is because pronouns, they're used to refer to either the person who you're talking to or somebody in the third person. So we use pronouns like I or you, or usually more often in the third person. So it's like, she likes that cat, you know, he's a fan of the balls. They really like to go out on the weekends. So those are third person pronouns. And pronouns in the English language and in many languages are gendered. So you use a different pronoun when you're referring to a group of men than you're referring to a group of women. Or when you're referring to your friend Mike, who's trans man, than when you're referring to your friend Lisa, who's a cis woman. So because pronouns in the English language are gendered, it's important for us to then be intentional about the way that we're using pronouns, because we want to create and reinforce an inclusive environment whenever we can. So even if I'm a cis woman and my pronouns are just she and her, I'm saying that out loud still because I, again, want to create a landscape where other people feel comfortable to share their pronouns as well. And not assuming that because I present as a woman, I use she, her pronouns, because there are plenty of people who may present in a very similar way that I do who use different pronouns. So why is this a big deal? I want you guys to close your eyes or leave them open, whatever you feel comfortable with, and just think back today. So it's about 12:30 on Friday. How many times today has somebody used your name or a pronoun to refer to you? Just give that a thought. If someone's brave and they want to take a guess out loud or drop it in the chat, you're welcome to. But the main point is just kind of hold that number in your mind and realize, really reflect on how often that has happened. We do this a lot, and it's in our email communication, it's in our text communication, in our verbal communication. We are constantly using someone's name or their third person pronouns to refer to them. So imagine that your coworker, you started a new job, and your coworker is always using the wrong pronouns or constantly calling you the wrong name. So that means that the number of times you've heard your pronoun or your name today from that coworker, they're just constantly using the opposite one or the one that you feel does not describe you. That would be really hard. That would be really hard if all day, every day, I'm hearing from everyone in my life a pronoun that does not fit me or a name that I no longer identify with. So that little mini kind of thought exercise is what I want you to keep in mind when you're thinking about, well, what's the big deal with this anyway? The reason it's a big deal is because we use name and pronouns a lot in our conversation. And it's one of the sort of quickest and easiest ways to create an inclusive environment and to make people feel accepted and validated is to use correct name and pronouns. When I say correct, what I mean is using the pronouns of their choice. So using a person's chosen name and pronouns, it's essential to affirming their identity and also showing basic respect. If someone, so my name is Caitlin, if someone called me Catherine all day, every day, I would feel really disrespected. I would feel like you don't even know who I am. Why are you even bothering to talk to me? This would probably also frustrate me or maybe make me feel sad over time because I learned that no one's going to use my real name. And so I just kind of, I don't know, don't really feel that good about myself over time. And that's because my name is not being used correctly over and over and over again. So by using the name that someone wants us to use for them and their pronouns, we first of all just show them respect as a human being, but it's also very affirming of their identity. And the experience of being misgendered, if you hear that phrase, what that means is that we use incorrect pronouns to refer to someone. So that would be someone using he, him pronouns for me. That would be someone misgendering me because I don't identify as male or masculine. But if someone was like, oh, that Caitlin, man, he's always causing trouble, you know, on Saturdays, especially for game day, like he's a big pain in my butt. I would be like, okay, you don't even know who I am. That can be very uncomfortable and hurtful over time because I'm being misgendered. And so using correct pronouns and names helps us avoid some of those potential hurt feelings or the potential embarrassment that we can cause for other folks as well. We'll come back to a little bit of pronoun etiquette, but by providing and asking about pronouns, we get more comfortable interacting with others, but we also can help avoid assumptions. And I will never forget growing up when my dad said, assuming makes an ass out of you and me. That's how we spell assume, right? But that's also something to keep in mind with our pronouns, because if we're assuming that someone's pronouns are something and then we aren't actually accurate on that, we're making an ass out of ourselves, but also for the other person, it can be hurtful for them. So normalizing just asking pronouns or providing your pronouns helps make that easier for you, but also others who you may be working with or working alongside. So I have this on here, not as anything major other than just a brief kind of grammar lesson, because I hear a lot of people like, I can't get in the habit of referring to somebody in the third person, like they, them, third person plural. And I push back on that a little bit for folks because I'm like, we do that all the time. If we don't know someone's gender, we just fill it in with they or their. So for example, someone lost a cell phone in the Uber. I get in the Uber, I'm like, oh no, someone lost their cell phone. I'm using their, which is a third person plural pronoun, because I don't know the gender of the person. So we're already in that habit just linguistically, but we don't often think about it related to an individual person. But these are some examples of like the subjective, objective, possessive, and reflexive pronouns. This is going way back to 6th grade grammar for me, which conveniently my mother was my teacher for that. So some of this is just bored into my head. But this is just a nice little table example. If you want to have something like a cheat sheet nearby as you're writing emails or talking with folks, there's some other really helpful resources online of additional examples of pronouns that folks may use and in these kind of various formats. Okay. Briefly, pronoun etiquette. So like I was talking about before, it's important to create opportunities for people to share their pronouns with you rather than assuming you know their pronouns based on their appearance. So instead of someone looking at me and being like, oh, she looks like a woman, I'm going to go with she. What would happen instead is like, okay, what pronouns do you use? Or, hi, nice to meet you. What would you like me to call you? Those are some example questions that you can use. I often go with, what pronouns do you use? Or what pronouns would you like me to use when I refer to you? Like when I'm meeting new clients or introducing myself in the room, I'll ask, but I'll also provide my own. So my pronouns are she, her. What pronouns do you want me to use for you? So that's how we normalize that. We just openly ask the question. That's considered kind of best practice or best etiquette when it comes to pronouns. Again, always use someone's chosen pronouns unless you've been asked not to for a specific reason. So I won't come back to the nitty-gritty of that, but essentially sometimes we don't want, or folks who are marginalized may not want us to use certain pronouns if they haven't come out to everyone in their life. So sometimes I work with teen clients who they've come out to me or their friends, but they've not come out at home yet. And so they tell me, I would like you to use he, him pronouns in the room when it's just us in therapy, but in front of my parents, use she, her, hers. I'll be like, okay. So I'm not going to do that unless they ask me to. So go with what the person in front of you is asking them to call you. And always, even if that person is not around, use their chosen pronouns. The easiest way to get into the habit for this is just practice. Just like anything else, practicing makes perfect, or practicing makes it easier for us to get into this habit at the very least. I don't think perfection is something we can ever attain. But again, even if the person's not around, in conversation and written communication, use the correct or the chosen pronouns for that person, and I promise you it will become easier. Oftentimes, you can just do this out loud by yourself as well. So I've done that before sometimes to practice, like, okay, I'm seeing this client, and just out loud to myself, I will use their pronouns as I'm talking about them, not only because that's affirming their identity to whoever I'm speaking with, but also it's making it easier for me to get their pronouns right when I'm interacting with them. If you make a mistake, however, just apologize and move on. You don't have to make a big deal out of it. You don't have to hit the mistake over and over and over again. Just say, oops, I'm so sorry about that, and then move on. Oops, I'm so sorry. I'll try and remind myself next time and move on. And it's okay. People are going to mess up and make mistakes. That's part of all of us being human, right? It's just a matter of acknowledging our mistake, apologizing, and moving on. And then in terms of holding our other sort of team members accountable as well, it's okay to gently correct other people if they misgender someone. Oftentimes it's not on purpose. It's very rare, I think, for people to intentionally misgender someone. So if you notice that, just feel free to be like, oops, I think they use these pronouns. Most likely the person will be like, thanks for the reminder, I forgot. Or they'll be like, oh, I didn't know that, thanks for telling me. So if you hear that in someone else, do your best to speak up and correct that misgendering if you can. Okay, I want to go through a couple myth-busters, myth-busting episodes. I thought of myth-busters episodes when I was making this slide, clearly. But I want to go through a couple kind of common misconceptions or myths that folks might hold about members of the LGBTQ community. So sometimes people will be like, oh, these youth are so different than other kids we work with in foster care. But in reality, everybody has a sexual orientation and gender identity, even if it's not something we talk about all the time. But everybody has that because you can't not have it, right? But even if your gender identity is cisgender and your sexual orientation is heterosexual, you still hold those orientations and identities. So LGBTQ youth in foster care and LGBTQ youth in general, they experience the same milestones, the same experiences as their non-LGBTQ peers. This is just a phase. This is one of the big misconceptions I hear a lot. So this attraction to women or this gender identity, it's just a phase. They're going to grow out of it. But most people report knowing their sexual orientation around age 13. 13 is when that kind of starts to solidify for folks, and gender identity typically, again, stable around sort of 3, 4. What that means is that for a lot of folks, this is not a phase. This is who they've been their whole life. Or if you are if you're working with somebody who's coming out later in life, that doesn't mean that this just all of a sudden appeared, or that this is a phase they're going through now. It might just mean that they didn't know there was something else out there for them until they started to learn more. And a lot of times, older members of the LGBTQ community at this point will talk about some of those experiences where I was, considered straight or cis for a lot of my life. And I learned a lot later that there was a whole community of people who were like me. And now I identify as trans. There are plenty of beautiful memoirs, essays, stories from folks who will describe experiences like that. So none of these expressions, whether identity or orientation oriented expressions, are considered just a phase. Someone caused them to be gay, or someone turned them trans. We hear that a lot. Someone or something causing this identity. But sexual orientation and gender identity are complex, and they're a result of many genetic, biological, and environmental factors working together. So there is no one specific cause. There's no one gene. There's no specific hormone that we can point to. These experiences, these orientations and identities are really complex and informed by lots of different factors. This can be a little bit of a misconception too, that LGBTQ youth are more likely to have mental health diagnoses or behavioral challenges than other youth because they are LGBTQ. So the reality of this is that LGBTQ people do experience higher rates of certain mental health challenges like anxiety, depression, substance use, suicidality, relative to the general population. But it's not because of anything about their LGBTQ identity. It's because of the stigma and discrimination they experience and the stress they experience from others that lead to those increase in rates. So for example, a teen in my office who has pretty intense depression symptoms, who recently came out as transgender, it's not because they're transgender that they're more depressed. It's because they came out and were rejected by their family members that they're experiencing symptoms of depression. So it's not, those difficulties are not stemming from their LGBTQ identity in and of itself. It's stemming from the stigma and discrimination they experience from others or from systems they interact with in their life. Another one, LGBTQ people are more likely to perpetuate sexual abuse or pose a threat to children. This is not one I've heard in a while, but it's definitely a myth that I have reckoned with before. And the reality of that is that perpetrators of abuse are always most likely to be family members or someone the family trusts. So just because there's a trans community member in your church does not mean that that trans community member is going to be more likely to perpetuate abuse. In fact, it's the people closest to that kid who are most likely to be a perpetrator of abuse, excuse me. So that's a big misconception. Another one is that they can change their gender identity or sexual orientation. There's a whole brand of therapy called conversion therapy based on this idea that you can convert someone or change who they are into something else. However, medical and psychological experts agree that attempting to change someone's orientation or identity, not only is it useless because it's not going to work, but it often is harmful and usually can cause physical and mental health, negative physical and mental health outcomes and decrease in well-being. So conversion therapy doesn't work. So it's not going to work anyway, and usually it's adding harm. And then another misconception is that one must feel like they have to choose between their faith or their religious values and supporting LGBTQ youth. But especially more recently, many religious groups and churches and segments of religious populations are starting to embrace LGBTQ youth and adults and families and trying to offer more affirming and supportive spaces. So there's definitely a shift, I would say, in a lot of the major religious groups, at least in this country, toward a more accepting and affirming space. However, acknowledging that, yes, there oftentimes is sort of this tension that's set up whether it's set up by a particular preacher or by a religious group leader or within a particular church family. There may be a tension that is set up kind of artificially, but that doesn't have to be that way. Okay, I want to briefly talk a little bit about research. So LGBTQ youth in foster care are vastly overrepresented. So about 5 to 7% of the general population of youth identifies LGBTQ, but about 30% of kids in foster care identify as LGBTQ. So a huge jump. They're vastly overrepresented, in our foster care system. Youth who are LGBTQ are about 4 times more likely to be homeless. They're usually describing that they're kicked out or they ran away because of their identity. So not for any other reason, not for a trauma or abuse they were experiencing in the home outside of their identity, but oftentimes it's kids who describe they came out or they were outed to their family who was not supportive and they ran away. So they're 4 times more likely to be homeless. They're also likely to experience around 2 times more placements than non-LGBTQ peers in foster care. They're also far less likely to find permanency, whether through adoption or kinship placements. And then around 80% of these youth, after they have run away from foster care, they run away from their home, and then they're often running away as well from foster care because they report experiencing aggression based on their orientation or identity. So not only are these kids running away in the first place from home, they're then often not finding support or validation in their foster environment and running away again. And about 13% of LGBTQ youth compared to about 6. So really half double, I guess, as many kids who are LGBTQ report that they're treated poorly or perceive they're treated poorly by the foster care system. So that may mean they don't feel validated by their care worker. They may feel like their placement's not a good fit for them, compared to about 6% of kids who don't identify as LGBTQ. In addition, our LGBTQ youth of color, they face significantly greater odds of being placed in foster care, even compared to white LGBTQ youth. And they're also more likely to have sort of the significant mental health disparities we're already talking about. Those tend to be worsened for youth of color who are LGBTQ compared to white LGBTQ kids. Suicide attempts go up a lot, 3 times greater odds of having a past year suicide attempt if you're LGBTQ youth in foster care compared to those who are identifying as LGBTQ but have not been in foster care. So being in foster care and being LGBTQ really increases your risk for suicidality. In addition, kids who are LGBTQ but who are also juvenile justice involved, they're about double as likely to have experienced child abuse, multiple group home and foster care placements, and homelessness, compared to kids who are already at risk, who are JJ involved youth, but they're not LGBTQ identifying. And then in the school setting, about 80% of students reported verbal harassment, specifically because of their identity while at school, and about a 70% report they don't feel safe. So in a school setting where they're spending most of their time, a lot of these youth, the vast majority of them report experiencing discrimination or bullying at school and not even feeling safe in their school environment, which, I don't know, maybe makes it a little bit hard to learn if you don't feel safe in your classroom. Okay, so I'm keeping an eye on the time and also want to pivot a little bit to talking about how to support some of these LGBTQ youth. So one of the main takeaways, I think, is that we need to affirm these kids. We need to be affirming of their orientation, affirming of their identity and their expression. So that means, like, it's okay to paint your nails if you want to. Sure, grow out your hair if you feel like it matches who you are. Okay, you want me to use these pronouns this week? Great, I'm happy to do that. So it's not the questioning, it's not the like, are you sure? Have you thought that through? Well, what about this? It's taking what the kid's giving to you and being like, okay, yep, I affirm you, I validate you. We will continue on that path. Kind of, I'll go with what you tell me until you tell me otherwise. Using LGBTQ inclusive language. So this is related to family and relationship status too. So a lot of times we're assuming kids we work with have a mom and a dad. A lot of times they don't have a mom and the dad. They have grandparents, they have other relative caregivers, they might have 2 moms or 2 dads or single parents. So we're trying to use inclusive language when describing kids' family status, but also their relationship status. So if we know, for example, that there are sources of stress for kids on our caseload in various settings, like in the school setting, we're identifying and working to reduce some of those sources of distress. So say there's like one teacher in this kid's classroom and they always use the wrong name for this kid. We can work with the school and help remind that teacher or discuss with the principal or the counselor if we need to, why it's important for that teacher to use the correct name so we can help their stress in that school setting go down. Connecting with youth with support groups or student organizations is a beautiful way to increase support for these kids, making them feel seen and validated, but also feel like they can connect and interact with other youth who are like them. Checking in with them to see if they feel comfortable with agency recommended service providers. This can be tricky because oftentimes, therapy wait list is like a year and they just get assigned to a random therapist. And it's just like, well, geez, we've been waiting on therapy this whole time. You really just hope it works out. But something we can do to kind of go above and beyond is just check in. Like, do you feel comfortable with your therapist? Do you feel good with your doctor? Do you feel safe in this setting? Just to check in with them and make sure. And if they're saying no, believing them and helping them switch to find a different provider. Part of that too is thinking about, okay, with the medical providers my kiddos are seeing, we want the providers to be talking to them about sexual health and wellness. And in particular for transgender youth, connecting them with a healthcare provider who is trained to talk with them and address their health concerns, whether it's concerns related to mental health, concerns related to physical health and transitioning, but ensuring that, in particular, trans youth are connected with providers who will be affirming, but who also are trained to appropriately give correct healthcare information and guidance. Going back to that piece about a therapist, we want, if possible, for these youth to be working with someone who's trauma-informed and LGBTQ competent, or someone who feels comfortable as a therapist working with this population, not dropping a kiddo off in a room with like, oh, okay, I have no sense of what this person's comfort is working with LGBTQ youth. As much as we can, match those kids with providers who feel comfortable working with them and who also will be competent working with them. Under no circumstances should any youth ever be forced or encouraged to go to conversion therapy. There's a new horror movie on Peacock called They, Them. I think it's on Peacock, it might be on Hulu. If anyone wants to check that out, feel free. It's about a conversion camp gone awry that turns into, a horror movie, as you can imagine. But I was glad to see the preview come out for that movie because it's a very, this used to be, I think, potentially a more controversial topic than it is now, but conversion therapy is a no-go, no matter what. And so we always want to be making sure that kiddo is working with a therapist who is going to be supportive of them, not somebody who's trying to change them. So I know we have just a couple minutes left. I'm hopeful that this link will work. Can someone give me a thumbs up if they can see this screen? Okay, great.
I am who I am. I'm not going to change for anybody. I never have. I never will. And that's caused me a lot of grief in my lifetime, but that's the only way you can be. At age 6 or 7, I was removed from my mother and given to a guardian. My mother was going to jail for a DUI. The guardian was the next best option. Things were going okay with her. We were young. 4 years later, that turned into physical and verbal abuse, eventually sexual abuse from someone else. At the age of 12, I finally had enough and was acting out and was placed into foster care due to being unruly. Went to my first foster home, lasted there 11 days, and was kicked out of there and went to my second foster home. Was there almost 2 years. Once again, more verbal, physical, emotional, sexual abuse. Done what I had to do to get out of there. It wasn't the most appropriate, but nobody was listening to me in the state. So I went to several more foster homes and group homes. At one point, I was placed into a faith-based organization. And of course, being LGBT, I was basically forbidden to be myself. And anything with them was basically, what can we do to turn you straight? They wouldn't directly say that, but that was my impression of them the whole time based on their actions and the therapy they would force upon me. They wanted to keep putting me in cognitive behavioral therapy, thinking that it was going to change me. At one point, I was placed in a town where the only LGBT person that was out was completely shunned. And it was almost like, even though they had homes in other counties, they placed me in that one particular county. I knew that being in that organization that it wasn't going to be a good fit, but I had no option of saying I don't want to be here. I was still placed with them for almost 3 years. Finally, it took me cutting and a suicide attempt to get out of that organization, because finally they bumped my level of care up. Eventually overcame that at 17 and aged out at 18 and been on my own since. So I am now 23 years old. I'll be 24 in March. Been out of foster care for almost 5 years. Work 2 full-time jobs and go to school full-time. I do case management, and I am also a high school special education teaching assistant. I've always been a helper. If you don't help someone, I feel like there's nothing else for you to do. So the day I quit helping will probably be the day that I'm rolled out on a stretcher. I am a drag queen, and my name is Shania. So I do that just for fun and kind of as a way to show other young people that you don't have to be afraid of who you are. Still do a lot of advocating, especially for LGBTQ youth and recruitment of foster parents for teens. One of the things that I've really been pushing for was more education to the foster parents, to the social services, to the public in general, that we're normal human beings. There's nothing different about us. You don't have to be afraid of who you are.
Okay. So I share that story from Timothy in Tennessee, just as we close today with the main takeaway. It's that you don't have to understand cognitively what it means for someone to be LGBTQ in order to respect them. And to me, that's the biggest takeaway, is we can respect and affirm those we work with without fully understanding or without even fully agreeing. But just keep in mind, love is love, and we are all human. Resources here for those who are interested. Thank you all so much for your attention. Feel free to drop any questions in the chat, or go ahead and come on mic and share those now. I know we are right up against the 1 o'clock hour, so I appreciate everybody's time.
Thank you so much for the presentation. I think you and I at least can stick around for questions if people have them. So don't hesitate, just because of time. While people are thinking of their questions or typing them, I want to remind you all that Karen has dropped in the chat the link for the questionnaire. Please complete the survey, and that's how you'll get your certificate of completion. Also, that's how we're going to get feedback from you on how you think it went today, so we can kind of continually work to improve. Not that I think there's much to improve on. I think that went really well. Thank you so much, Dr. Williams, for this presentation today. So much really good information that I think is just so needed out there in the community.
Mm-hmm. Yeah, feel free to email me or get in touch if you want to go through any more resources, if you have additional questions. These are some great ones to start with, but there are plenty others available. Thank you all.
Yeah. All right. And our next learning collaborative will be next month, 3rd Friday in October. Hearing me talk